I will say it just warms my heart additionally as I stand here and take in all of you, seeing you've taken time out of your busy schedules to be here with us on this important inaugural day. And it's a testament to how important this initiative has been and how important the Center for Industrial Base Management and Supply Chain is. So thank you all for being here. And as Arlene said, I am Nikki Bratcher Bowman, and for the last 4 years, during the height of the COVID-19 pandemic, the Center for Industrial Base Management and Supply Chain, which was then known as the Office of Industrial Base Expansion, was specifically created by the United States to build a robust and resilient public health industrial base. COVID-19 showed us many things, and one of the things that it showed us in particular was that building the public health industrial base was a matter of national security, and that we desperately needed to prioritize the medical domestic supply chain in the United States. And the reason for that was simple. U.S. companies were encountering multiple challenges with their supply chains, and those problems affected their ability to produce, and it affected our ability within the United States government to deliver personal protective equipment, diagnostic tests, therapeutic treatments, and vaccines during the COVID-19 response. And I am so glad that we stood up the Center for Industrial Base Management and Supply Chain. That team has gone to great lengths to focus on this problem of the medical public health supply chain and on long-term solutions to address the challenges. So part of why I'm here today is to walk through some of the accomplishments, just briefly, that this office has been able to achieve to date, and to serve as a reminder to this team of the great work that they have done, and to you all, a demonstration to our industry partners of our continued commitment to go even further, because we know that this is just the beginning. Through our work in platform technologies for pharmaceutical manufacturing, ASPR has invested more than $325 million to develop domestic production capabilities for critical active pharmaceutical ingredients. And as a result of these investments, domestic pharmaceutical manufacturers are establishing continuous and highly distributed manufacturing capabilities using technologies that requires only a small footprint to make sterile injectables and solid dose form drugs that are in short supply. Being able to produce such critical medications on demand will not only increase supply, but potentially change health outcomes within health systems that are most vulnerable to drug shortages. ASPR is investing in decreasing the barriers to private industry for the commercialization of new technologies and manufacturing capabilities, allowing the domestic production of pharmaceutical and medical supplies in a highly scalable, cost-competitive, and widely distributed fashion. Another area of notable progress that we've been able to have substantial impact in is in the area of personal protective equipment. PPE and its key chemicals and the components were not produced by the U.S.-based industries. And prior to the pandemic, the PPE supply chain was not a focus of the U.S. government. As the response to COVID-19 matured, the U.S. government efforts shifted toward building an end-to-end domestic supply chain for PPE, from key chemicals to intermediate materials to final manufacturing, packaging, and distribution. The critical medical equipment team within IBMSC was able to build from the ground up a program that has invested $1.7 billion in PPE-related contracts, including nitrile glove and gown production, surgical and N95 masks, melt-blown fiber, and nitrile butadiene rubber, ensuring that we're able to provide PPE when America needs it most. Many of these contracts were transferred over from DoD and are still in progress, with your team helping them to come to a successful end. And apparently, a running theme among the IBMSC group is that they enjoy doing the impossible. When the President announced a few weeks before Christmas, about 2 years ago, I was on the receiving end of a call announcing that we were going to be sending out 500,000 free COVID tests to American people through covidtest.gov. This team built the entire infrastructure behind that effort, and we were navigating our partnership with the U.S. Postal Service and the White House. And now through round 6 of what has become an earmarked program for this administration. This team didn't stop there. They ensured that our most vulnerable had access to testing through establishing a wide variety of partnerships, including with long-term care facilities, nursing homes, federally qualified health centers, food banks, Section 202 housing, and the Department of Education to ensure that there were no barriers to testing. This team made it just a little bit safer during some of the most uncertain times of the COVID-19 response, and their work continues today. Another area of important focus is with respect to our Title III authorities that are critical to protect the public health and the medical supply chain and direct needed materials for national security. During the COVID-19 response, we issued 71 priority ratings to ensure that the materials needed for manufacturing of vaccines, therapeutics, and tests and other critical supplies were available to U.S. health care providers and first responders. Exercising the Defense Production Act is a powerful tool that we only deploy when we have to. But it is a critical tool within our toolkit during times of emergency and disasters that ensures that materials keep moving through the supply chain to support a unified response. Post-pandemic, the Defense Production Act Title III will continue to play a critical role. In fact, last November, the White House announced a series of new initiatives to strengthen supply chains to America's economic and national security. Among the 30 highlighted actions was a commitment specifically to broaden HHS's authorities under Title III of the Defense Production Act to enable investment in manufacturing of essential medicines, medical countermeasures, and critical inputs that have been deemed essential by the President for national defense. The supply chain team is also our think tank and our surveillance capability. We fondly refer to them as our supply chain watchdog. They specialize in being on the alert and identifying parts of our supply chain that are most vulnerable to disruption and in most need of optimization. Their solutions are helping us to optimize the supply chains, such as logistics technologies and innovations or manufacturing process improvements that are invaluable. In short, they keep us alert and aware of what is going on so that we can quickly and efficiently develop solutions to prevent supply chain disruptions. I am enormously proud of the work for the Center for Industrial Waste Management and Supply Chain and all that they have accomplished to date. And today is just the start. And it's also a continuation of something great. And I look forward to the success stories, I am sure, to come as a result of this inaugural summit. Thank you all for being here, and thank you for this time.